So there's no better gift to give to your body than to prepare it and getting your body to the best place it can to serve you effectively, to bring in your precious ones to life. Hello and welcome once again aboard JulieCity. How are you keeping? I hope you're keeping well and safe. Thank you for clicking to watch today's video. You're highly appreciated. So today's video is a response to a question that was asked regarding the gestational diabetes video I did. And I'm going to be reading that question out and display it on the screen as well. So it says, this is by Ruth. And the question goes, can gestational diabetes be prevented? That's the first part of the question. And the second part of the question says, can diet predispose one to gestational diabetes? If yes, what precautions can be put in place? And that is the question that I'm going to be addressing in this video. I hope you're watching Ruth, and I'm sure there are tons of others who want to know. So thank you for asking that valid question. Now don't go anywhere. Just sit tight, get a cup of tea or water, better still, and let's dive into the video. In order to keep this video as precise as possible, I'm not going to delve into the whole details of gestational diabetes. Rather, if you've not watched that video or you want a bit of a refresher, then check my channel, this channel, JulieCity, to watch the gestational diabetes video. And I'll also leave it as an end screen at the end of this video. You can click it after watching this. I will leave it as well as a card, so it will be popping up towards the end of this video. You can click to watch. That way it will flow accordingly. So there are two aspects of this question which I'm going to be addressing. The first question is saying, can gestational diabetes be prevented? And as much as I want to jump to say yes, research is showing that you might not be able to prevent gestational diabetes. However, there are things or tips that will help you reduce the risk of developing gestational diabetes in pregnancy. Now, the first tip, which I covered very well in the previous gestational diabetes video, is the idea of planning pregnancy. So pre-planning a pregnancy. Especially for those who already have an existing medical condition, it goes a long way to help them have a seamless care and a trauma-free care. Insulin is less prioritized in certain women during pregnancy, so the body does not get enough to process the sugar that has been taken in, thereby causing the spike, causing gestational diabetes. So the big tip will be lifestyle. Making adjustment to our lifestyle before pregnancy will go a long way to reduce the risk of developing gestational diabetes. Before I continue, I also want you to know that research has also shown that as much as gestational diabetes will go away following the birth of your baby, there is still the high chance that those women who develop gestational diabetes in pregnancy are likely to have diabetes later in life. That is what research says. And that, of course, makes the concept of lifestyle adjustments and lifestyle changes make sense. So in a nutshell, what am I saying? Making lifestyle changes is one fact that can help reduce the risk of gestational diabetes. These lifestyle changes draws us back to the fact that it's important to pre-plan one's pregnancy. Yes, best practice is to pre-plan your pregnancy. So prepare for your pregnancy before you get pregnant. And by lifestyle changes, I'm talking about three things: healthy eating, exercises, staying hydrated. These three things will go a long way to reducing a person's chances of developing gestational diabetes in pregnancy. Make healthy choices with regards to your food. Consider swapping fizzy drinks to healthier option. Maybe juicing. You can check out my channel on Juicing Julie. You'll find healthy options. Or you can try something like sparkling water if the fizzy is what is attracting you to the fizzy drinks. You can add fruits and vegetable to influence the flavor, if that will also help you reduce the amount of fizzy drinks or healthy fizzy drinks that you're drinking, because it's shown that fizzy drinks contain a whole lot of sugar. Remember, we talked about gestational diabetes being that the body is not able to produce enough insulin because the body is busy producing other necessary hormones that will help to carry the pregnancy effectively to term. Somehow, insulin is not its priority. So the best thing now is to choose healthy options that are low in sugar. That way, your body won't work too hard to digest your sugar. Whatever insulin it is that you make, your body will be able to use it effectively to keep your sugar levels down during pregnancy. So that is one thing you can do. Now, exercise is the other thing. One thing that we do as midwives during the booking appointment is to check your height and your weight. That gives you a body mass index. And like I said, I covered that in the main video. So please watch it to make this one make sense. And if you are able to be on a healthy weight before getting pregnant, then your body will not have to look for so much insulin to digest sugar. So if you're able to keep your sugar consumption low, go on exercise in order to burn the ones you've eaten. These are all before pregnancy. Then the chances of developing gestational diabetes will be well reduced. Another trick in the book will be in between your meals. Make sure you keep hydrated. Drink water. Water is good for you. Milk is good for you. Fresh juice, freshly squeezed juice, and fruits, vegetables are good for you. If in between you keep healthy with healthy options, then you won't need to consume a large amount of food, carbohydrates, or whatever it is. That way, your body has less work to do in terms of insulin and digesting or processing sugar in your body. Look for healthy snacks as an alternative. Instead of crisp and all the other sugary stuff, go for fruits, go for vegetables. And if you have to do them, it's not about quitting them completely. Make sure that they are optional, once in a while snacks. Yes, it's hard to say cut off everything. No, it's not about drastic cut off everything. It's following the food ladder and making your choices accordingly. Exercises. I think research says something like 150 minutes of exercises, planned exercises in a week will go a long way to helping you. So when you now get pregnant, you're already in these habits. So it's easy for you to carry on along because something your body is already used to. That way, you are reducing your chances of gestational diabetes. If you're living with overweight or obesity, if you need help, then seek help. Find your way to the professionals responsible to help you lose weight in a healthy way. It's important to follow a healthy option that you can maintain over time. If one pre-plans their pregnancy, then they'll be able to do all the weight loss they want to do, get into a healthy eating habit, get into a healthy exercise habit before pregnancy. And if you need help or support to help you achieve that, then speak to your healthcare professional, speak to your doctor, your midwife, go for pre-pregnancy counseling. Yes, go for pre-pregnancy checkups at your doctor. Yes, there's something like that. It's just that most people don't tend to do it, but yes, it does exist. If you book an appointment with your doctor, tell them you're coming for pre-pregnancy checks. Yes, you can be checked, tests can be conducted. Then you have a baseline to work with. And if you need extra help in losing the weight, then the support you need will be given to you, and you can put a plan in place that will help you lose the necessary weight before getting into pregnancy, because losing weight during pregnancy is not advised. Weight loss program during pregnancy is highly not advised and not recommended. And if you're not overweight, your healthy weight, is still important to pre-plan pregnancy. Yes, go for pre-pregnancy checks. Get your body ready. Look, your body is going to be doing a very important job. It's going to be bringing life to birth. So there's no better gift to give to your body than to prepare it by pre-planning it, going for necessary tests, knowing what you can do and what you cannot do based on your individual circumstance, and getting your body to the best place it can to serve you effectively to bring in your precious ones to life. Like I said, I want to keep this video precise. I hope I've answered this question effectively. And if you find it useful, then like this video, leave your comments, suggest more things, give us more tips. We are always listening in and we're always learning. And I love to hear from you in the comment section. Remember to share this video. And I'm going to be leaving the links on this pop-up screen. So click on it and watch. You can also check out the videos, like I said, on my channel. Go to my main page, click on videos, and you will see them chronologically lined up. Till I see you next time, don't forget, your health is your wealth. Take care and bye-bye.